Hi, my name is Dr. Rob Ward, and I want to welcome you to another video class at the redoxdoc.com video conference series. This class is about stroke, and it is a timely topic because it is the second leading cause of death in America and in most industrialized countries. And it's not changed over the last 30 years. It's still the second leading cause of death. So there are profound redox connections in stroke, and it is a redox event, and I'll explain that in just a minute. So let's talk about the signs and symptoms and the nature of stroke and give you a little background. So strokes have been occurring for many, many years on the same level of occurrence, despite more aggressive treatment of blood pressure, more aggressive treatment of cholesterol with statin drugs, and the use of clot busting medications like TPA at the time of strokes when they occur, if you can get to the person quick enough. In spite of those three huge endeavors that have happened over the last 30, 40 years, we've not seen a change in the incidence of stroke countrywide. In some urban centers, there's been a slight reduction. In more rural settings, there's a higher incidence. So why is this? Why have we not been able to help this problem? And by the way, those statistics are very similar for heart disease and heart attacks. We haven't really seen a change in the death rates. So the reason is that we don't really have any primary prevention measures at play. In the medical world, we do secondary preventive measures. I'll explain what I mean by that in just a second. So if we can get to primary preventive measures, we can really change, I believe, the incidence of this condition. So let me tell you what strokes are like. In case you don't know, there's two kinds. They're both resulting in nerve cell death in the brain. Okay? So how do the nerves die? They die in this situation because there's a lack of blood supply. And when that blood supply is cut off, oxygen's cut off, nutrients are cut off, and the cells die for lack of circulation. So in one case, there's what's called ischemic strokes. In this condition, if this is a blood vessel inside the brain, there is a blockage in there that's causing a breakdown in the flow of blood. And at some point, it goes so slow that it forms a sludge, and it forms a clot, and it blocks off the supply. So everything downstream dies, unless there happens to be a separate little vessel that provides a collateral circulation. So especially in a younger person, if there's a blocked artery, a major artery, it's devastating, just like a heart attack is devastating. An entire section of your brain can die. And that's why you'll see sometimes people have a droopy lip, they can't move their face, their eyes are gazing, their arm is weak, and their leg is weak, all on one side. Okay. The second kind of stroke is what's called hemorrhagic. And in this case, there's a hemorrhage of a blood vessel. So as the blood's going along, there's a break in the blood vessel. That weak spot could be due to a buildup of some cholesterol or a breakdown in the strength of the blood vessel. Maybe there is a malformation. And so at that point, blood starts to leak into the surrounding tissues, and that causes a breakdown in blood supply. The blood accumulates, it forms a big blob, and it compresses on the brain, and it causes damage to the brain cells that way. So it turns out that this kind of stroke, an ischemic stroke, is twice as more common than hemorrhagic strokes. And that makes sense because of their atherosclerotic vascular disease that happens in people. So what are the symptoms of a stroke? Usually it's weakness or a vision loss in the body. And the interesting thing is, it usually doesn't cause pain. The hemorrhage kind can cause pain because of the pressure that builds up from the building of that blood clot outside the blood vessels. It causes pressure on the lining of the brain. But our brain cells don't feel pain. You can stick a needle in your brain and you won't feel it. It might cause you to make your arm move because that needle's irritating cells, but our brain cells don't feel pain. And so strokes don't hurt usually. That's why they're so hard to diagnose at times. So if you have a weakness in your body, a change in your vision where you can't see properly, you may be having a stroke and you need medical attention right away. Don't hesitate to go to the emergency room. Your life could depend on it. So, by the way, the weakness and so forth is usually in a distribution characteristic of a nerve route of where that brain is affected. And it's not coincidental that 2/3 of strokes occur in people over 65. There's more apt to be these kind of vessel damages. So the risk factors for stroke include higher blood pressure, tobacco use, obesity, high cholesterol, diabetes, atrial fibrillation, which is an irregular heartbeat, which can send clots down the blood vessels. And we make a diagnosis usually with a CAT scan, a medical examination, an MRI, and an EKG to look for irregular heart rhythms as well. So prevention in the medical world is called secondary prevention, because there's not a prescription that's going to primarily protect you, but we can treat sort of the problems that are leading to the stroke, which is called secondary prevention. And that would be to take care of these issues, work on blood pressure, which is good to do, eliminate tobacco, get the weight off, change the diet that changes cholesterols, and take care of that blood sugar so the blood vessels are healthier. So in addition to that, we might want to prescribe aspirin, a medication for cholesterol, or even do surgery to open up an artery that is really getting narrowed, like in the carotid artery, and you might prevent a stroke by doing that. So if you got problems, these kind of preventive measures will eliminate the stroke possibility, but it's not causing these things to not happen in the first place. And the beautiful thing is, once people are having a stroke nowadays, if you can get to medical help right away, we can bust open those clots in many cases and prevent the death of the brain cells by opening up that circulation within 2-3 hours. It makes a world of difference in survival. Okay, so let's talk about the redox events that occur in strokes. And I ran across a landmark article that was written many years ago in 1989. And the amazing thing is that this was the first article that really got down to the brass tacks of talking about the connection between trauma and stroke for like brain cells that have been cut off from circulation, and the connection with redox biology. This was where it was first really made the connection. And so in this article, they discussed how free radical formation, or the formation of superoxides, this is a free radical where these little 2 oxygen molecules are looking for a hydrogen to complete them, and they'll go around and scavenge those electrons from anywhere they can find. So the production of free radicals in the face of stroke and lipid peroxidation, or oxidation of lipids in the lining of the vessels, that then leads to cell death. And so in this study, they were first exploring the use of antioxidants. It was a novel idea in 1989, and how antioxidants were able to help reduce cell death when there was a stroke. So tonight, what I want to do is to kind of take this to today's day. And we now know that all of this is true. There's been multiple studies that have replicated this concept. And today, as we look at stroke as the second leading cause of death, wouldn't it be great if we could live our lives in balance and not have to go into a medical secondary prevention mode, but literally help our body stay in a redox balance that prevents these formation of oxidation, formation of free radicals, and allows the body to sort of stay in balance. So here's the solutions that are primary protectors for the health of our blood vessels, okay? So primary prevention surrounds supporting the endothelium. The endothelium is the first layer in blood vessels. And these cells are always turning over. They're frequently replacing themselves. They have an incredible ability to repair themselves, but they need molecules, they need redox molecules to be able to do this work. They're almost as rapid in their repair work of themselves as the lining of our lungs. And when we activate the repair process with the presence of redox molecules, we allow the lining of that artery to stay in balance. It doesn't start to break down. It doesn't get inflamed. It doesn't start to rust. And it stays in a pristine form. Those cells know how to do this work, but they don't always have the redox molecules that are needed to carry out that activity. And that revolves around amplifying or improving the effectiveness of antioxidants in those endothelial cells. The second thing we can do, and by the way, we can support those endothelial cells by supplementing our body with redox molecules. As we age, we just don't produce them like we should. Our mitochondria, there's not as many mitochondria to create redox molecules. There's not as many mitochondria that create ATP for energy for cells. So cells get a little sluggish and a little tired, and they just don't do the work as well. So if this is a little endothelial cell and it's having to take care of itself, it needs a nice little bath of these redox molecules to help it do that work. Our lifestyle is something we have control over. And I think the day has come where our health resides in our responsibility. I don't think it's valid anymore to just simply say, well, I'm just going to continue to smoke or eat improperly. I can always go to the doctor and get a pill. If my blood pressure goes up, I can always get a pill. My blood sugar goes up, I can always get a pill. Well, those things aren't valid. It's good to do if you're out of whack, but then you've already got a disease and your life will be shortened because of it. So why not prevent that in the first place? So taking care of our lifestyle is something we can choose to do. The next category is to activate our cellular antioxidants. So if this is an antioxidant molecule and it's being produced in a cell, it has two arms. The first arm is going to go out and grab a free radical. It's traveling down the bloodstream. It's looking to damage that cell, and this antioxidant is going to stop that free radical from damaging that cell. So it's going to grab that free radical, but at the same time, on the other hand, it's got to have a redox molecule that has a negative charge available. And as it brings the two together, the free radical has a positive charge. As it brings them together, they're neutralized. So you got to have these molecules around. And if we're aging and not producing them at the proper rate and balance, we need to supplement our body with a redox supplement. We can do that today. And then I just have to say, it is not an either or situation. We can collaborate with the whole medical system, and it's absolutely not going to interfere or have any adverse effects as we supplement redox molecules. You can do both, and we probably need to do both. If you really have a problem with blood pressure and you're really not overweight, you really need some medical therapy for that. And as you do that, you can still supplement redox molecules because redox molecules will not interfere with the pharmacology of any prescription drug. And I can speak that from personal experience from around the world, being involved with the care of many patients who are doing both because that's what's required. And so it's perfectly safe and won't interfere with any pharmacology of any prescription drug. And that's a really wonderful thing. And it's a testimony to the basal or cellular nature of these little molecules and how they are native to our body. As we supplement them, we're merely assisting with the natural physiology of our bodies. So stroke is a scary and deadly situation that can develop. It develops when we don't take primary care of preventing the risks that put us at risk for this condition. And if you're developing symptoms of stroke, get to a hospital right away. It can save your life. But if you'd like to avoid hospitals, I certainly like to, then we take charge of supplementing our body with redox molecules, supporting the endothelium, assisting us with our lifestyle choices, activating antioxidants, and collaborating if we need to. So I hope that's been helpful. I look forward to the next class that we're together. Bye for now.